Councilmember Young.
Thank you. I heard you enumerate the things that you were supporting. I did not hear you mention money for Center for Closing the Health Gap. Are you supporting that too?
That's not in my proposal.
Is there a reason for that?
I put forth the items that I think should be funded on a one-time basis. As a general matter, I don't think that one-time sources like the carryover should be used for ongoing operating expenses of external organizations that have recurring operating needs. But I certainly think the center can and should apply for the human service funding that we have generously increased substantially over several years.
So we can fund Bethany House at $400,000 or $500,000 using a one-time source, but not the only organization in the African American community that works to save lives, that works to make certain children see their first year of life, to make certain that people who are underserved and underrepresented get medical attention, learn how to take care of themselves, that children in schools learn how to eat healthy, that neighborhoods that are without grocery stores learn alternative ways to access fresh fruits and vegetables, that this is an organization that addresses the disparate outcomes of health that occur in these underrepresented communities. We can't use a one-time source to fund that.
You can certainly make that proposal. Item 50, first reading.
Mr. Mayor.
Councilman Young.
I appreciate you perhaps not wanting to deal with this, but it's an important matter. There's a large segment of our community that is paying very close attention to how we treat the Center for Closing the Health Gap. And I don't think that being curt about this or avoiding answering my question by trying to throw it off on me and say, Wendell just put forth a proposal. It's pretty clear to me what you think, but I would like for you to be honest with the people of the city of Cincinnati and tell us what you think and why you do the things you do. Because it's clear to me that you have a beef with former Mayor Tillery. What's not clear to me is why you allow that to be the reason that you not only want to defund the organization, but destroy it in the process, and that you attack an entire community in the course of doing that. I don't view that as leadership. I think that the questions I'm asking are worth more than just saying, draw up a motion. I think you owe the people of this city an explanation of why you're doing the things you do. And if it's simply a matter of you not liking Mr. Tillery, I would suggest that we contact Buddy LaRosa. You and Mr. Tillery get in the ring, I'll sell the tickets, and we'll settle this thing.
Thank you. All right. Item 50, first reading.
Ordinance accepting a permanent easement.
Mr. Chair.
I'd like to move on with the meeting. We're going to
Obviously you would, but I have a question.
We're going to have this discussion. You're out of order. We're moving on.
I'm not out of order, Mr. Chair. I'm asking a legitimate question that deserves an answer. I ask you, will you tell us why you are acting the way you do regarding the Center for Closing the Health Gap? If you're not going to answer the question, say you won't answer it. Otherwise, answer the question.
I've made my proposal. I think the police are more important, and protecting the police is more important, and that is what I stand by. And you don't have to agree with it, but I also don't just like you don't have to answer my questions. I think you've made your point. We're going to have this conversation again next week, and I would like to move on with the agenda.
Mr. Chair, just one thing. You implied that I perhaps don't want to answer your question. What question did you ask me?
I don't have one. I'd like to move on with the agenda.
So you didn't ask me a question that I'm supposed to answer, is that correct?
Item 50, first reading.
I'll take that as a yes.